First, in today's health headlines, what to know about the current measles outbreak, whether or not you should avoid fresh produce right now, and how emergency rooms accredited in geriatric care are changing outcomes for older patients. Joining us this morning is Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Good morning, Doctor. Nice to see you.
Hi, thanks for having me.
Of course. So let's start with this. Measles cases here in the U.S. have surpassed last year's numbers. A little bit concerning. This is a record-breaking count over the past 30 years. Wow. What do we need to know about this, Doctor?
Yeah, for all practical purposes, we had been measles-free in the United States for 30 years. Last year, we had 2,200 cases. This year, it's only halfway through the year, and we've already hit over 2,300 cases across the country. A lot of these seem to be in South Carolina, Arizona, where some of the early outbreaks are, but it's very clear what's causing this. We have dropped below the 95% vaccination rate that prevents this type of spread of measles, and it's a really infectious disease. And so if you have not had your measles shot, your kid hasn't had your measles shot, this is an opportunity to get vaccinated and get ahead of this before it gets more out of hand.
Okay, really important advice there, Doctor. And I want to talk about this one. Forgive me. I'm going to cyclosporiasis, the C word that has been in the news lately. This is still popping up. But I think the big question for people is when they go to the grocery store, if they're looking at, lettuce, spinach, produce. What's the advice around that right now? Do we need to be avoiding produce altogether?
So this outbreak continues, several more thousands of cases reported over the weekend. And no, you don't have to avoid all produce. In fact, I had a salad over the weekend. What you do need to be careful about is a few things. One, tracking when the CDC or FDA actually posts a food recall. Right now, there is one such recall from Taylor Farms iceberg lettuce that came out of Mexico. And so avoid that. But otherwise, as long as you're washing your food, washing your hands, I think it is safe to continue eating lettuce, berries, other things that have been linked to these outbreaks in the past, but be careful and keep a close eye on it.
All right, good advice. Plus, emergency rooms that are accredited in geriatric care are reducing hospital admissions, deaths, and costs for older patients. Doctor, are you still there? And if
Yes.
so, okay, perfect. I just didn't see you for a second. So what can you tell us about this?
I think anybody who's been a parent or had kids has heard of a pediatric emergency department to take care of your kids. In many ways, this is similar to that. We've recognized that older adults need special care when they're in the emergency department. Here at Yale, we've actually accredited all of our emergency departments as geriatric emergency departments, and there's over 600 of these accredited by the American College of Emergency Physicians. And what they try to do is make care better for older adults, get them quiet spaces, reduce the amount of time that they're boarding in the emergency department waiting for a hospital bed, trying to provide special care coordinators that can focus on needs that older adults have. And these have been shown to reduce the chance of an older adult getting hospitalized and even lower the rate of mortality while saving money from the Medicare system.
Wow, very encouraging news. Dr. Venkatesh, we thank you for your time today.
Thank you.